Hello, welcome to our MRCOG3 MATC. So this is the previous one was a maternal collapse, and these are the obstetric emergencies I already to mention. And now this is the another emergency that is after the delivery of the baby. That is, the baby will be need resuscitation. The previously the mother and now the baby. So you need to know neonatal resuscitation. And because you're on the labor ward, you come across such babies who are flat and they need the support. So now you are this is a simulated colleague task, and to assess assessing the following clinical skills. This is the simulated colleague task. So here with the they will be assessing your communication with the colleagues, patient safety, applied clinical knowledge. So here you are an ST5 and you have been asked to teach John, a GP trainee, and the theoretical and practical aspects of the neonatal resuscitation. John, the student can be your junior colleague, or he can be GP, or anyone it can be. They can give anything. So you need to know the resuscitation. And so you have 10 minutes to teach your trainee about the neonatal resuscitation. So here you need to know in teaching about the trainee, you need to know about the introduction, whether they are rule out bullying, and so such thing which I am going to tell you. Hello, I am Angela. And then you wait. So he will say, "Hey, I am John. I am John." So you say, "How are you doing today?" Make him comfortable. "How are you doing today?" "I can see that you are here for training in the neonatal department. How long have you been here?" So a couple of weeks. "So how is everything in the department? Is everyone supportive?" "Yes, everyone is supportive." That means you're ruling or bullying. "And I'm getting adjusted." Then you say, "How can I help you? What do you what do you want to learn from me?" "I would like to know about neonatal resuscitation, Manjula." Sure. Then you say, "Sure." Then I'll say, "Sure, I'm going to. I really appreciate your interest to learn. And you can tell me why. Can you tell me why you are interested to learn neonatal resuscitation?" So then here in teaching, always you have to ask the rule of bullying, then why he is interested to learn, why he want to learn this topic, and also appreciate whatever he says. And then you say whether he knows anything about it also. Then when you ask him why you are interested, then he will say, I'm seeing babies being born with very low upguards and neonatal resuscitation is very important to learn. I feel it's very important to learn to save babies and prevent severe morbidity, especially when we work in the labor wards. So that is why I want to learn. Oh, that's very nice to know, John. It's very nice to know, John. Do you have any idea about it? Have you seen have you seen anyone resuscitating the baby? Have you seen any videos or someone doing it? So these are the few things you can ask. So he will say whether he has seen or not. Well, I will explain to you and everything about the neonatal resuscitation, and then anytime you have any question or any doubt, you can always interrupt me. Now we do resuscitation. John, we do resuscitation when the baby is gasping or not breathing. Normally, what happens? Normally, most of the time, the baby is born with vigorous breathing, good tone, vigorous breathing, or crying, and the heart rate is more than 100. And so we usually delay the cord clamping for more than 30 seconds because to prevent anemia. And also we dry normally. This is for the normal babies. Dry, wrap them to keep them warm and keep with the mother and maintain the temperature. And we encourage early skin to skin contact. And the breastfeeding also. So this way, these are the normal babies. And then but the main the on the other hand, when the baby is we see that the baby is hypotonic or breathing is inadequate, or the heart rate is less than 100, then we have to start the measures, resuscitation measures. So here we delay the cord clamping, and we delayed the cord clamping. We so check then we quickly, it's an emergency, we know it's an emergency, we can't manage alone, so then we have to quickly call for help. So you have to call for help, that's the first thing. Second thing, we need to check the trolley whether the required things are there or not for resuscitation. So it need to have, no, you need to know what to have, we need to know what things to have to be there on the trolley. So we need to have it need to have a flat surface with face mask, bag valve mask, oxygen, stethoscope, laryngoscope, 2 towels. Okay. Though, so we need to check the trolley for these things. What should be there? Can you tell me what should be there, John? Yeah, yeah, there should be some from face mask, bag wall mask, a stethoscope, laryngoscope. Yes, yeah, yes, good. So very good. Then we start the clock. So we should call. So I told you we should call for the help. Then start the clock. Move the baby onto the resuscitator. Then then note the time of the birth. We have to review the baby every 2 minutes while we do the resuscitation. Now, the first thing is we see that the baby is wet. So quickly there will be 2 towels on the trolley. So one is to dry the baby. So because the baby is wet, we need to dry the baby, and then don't we will remove it, dry the baby and discard it, and then take the other towel which is kept on the trolley. Wrap the baby. We'll wrap the baby and make it dry, already dried, and this will cause stimulation of the baby. Stimulate, so baby starts breathing. We can rub the soles or back, but no slapping. We are not supposed to slap. And then put the baby in the radiant warmer, and to keep the warm temperature has to be maintained warm. We should see that the baby is not hypothermic. So, and also check with the stethoscope that the chest is clear. So these are the 2 towels which are there. So one is to dry the baby, and second thing is to wrap the baby. So sometimes in the examination, you may have to show them to this junior. So this we have to do. So then now moving on to, so we have done this. Now we have to move on to the we already checked the with the stethoscope, check the breath sounds, and also we also check the heart rate. So these are the things, and then we start at the same time. Then assess the Apgar, that's the Apgar. We need to assess tone, color, breathing, heart rate. So can you tell me, John, what we need to see? 1 or 2 questions you have to ask. See the exam, just 1 or 2 questions, short questions. And so whatever you teach them, only you ask. So he will say, then, yeah, we need to check tone, color, breathing, heart rate. Yes, very good. You're a very fast learner. Now we will check we'll assess these things. That is tone, color, breathing, and heart rate. Then we'll see the airway. Ensure airway is opened. We will see ensure that the airway is opened. So now, if the baby is gasping or not breathing, we have to start this. So we have to start. Then that is that we are giving 5 inflations with the air. We'll start with the air. We give 5 inflations and apply also at the same time. We apply oxygen pulse oximeter, and also that will oxygen saturation. So we need to check, and ECG simultaneously. We can connect the ECG also. That is keep a check on the heart rate. Now the baby after that the baby need to be in neutral position. The baby is already in the resuscitator, so we need to check the baby's position. Now next is a position. So the baby should be in line with the in baby's head. The baby shoulder should be in line with the baby's head. By we can keep one pillow under the baby under baby's head, and so that they are in same line. So because if there is any, don't we are not supposed to extend or flex the neck, because that will cause airway blockage. So that is why we keep the baby in the neutral position. Then we have to after putting the baby in the correct position, we have to check the mask size of the mask. We need to take the correct mask that is on the which is on the trolley, and that should be if it should not be too small, it should not be too big. If it is too big, it will cover the eyes. If it is too small, it will be too tight, and so proper sealing we will not get the proper seal. So these are the things we should note. So then once the mask is kept on the baby's face, then we should give the CE grip. CE grip. What is C? So CE grip is where the mask is kept on the baby's face. The correct size. The index finger and the thumb are on the mask. That is like this. We are making a C, and the other 3 fingers will be lifting up the jaw like this. So we have to show in the to the junior in the examination. So like this with the three fingers. So these three fingers like E. So this is the CE grip. So now we start. Once the mask is placed on the baby's face, then we have to start the inflation. That is 5 inflation breaths are given. So I will tell you what are the inflation breaths. So these are the longer breaths. These are the longer breaths and slower ones. So longer and slower. Why? Because they are important. They squeeze out the fluid from the baby's lung and they create so that the capacity of the lung is created to create the capacity inside the lung. So this is the function of the inflation breaths. That is like we say 1, 2, 3, 2, 2, 3, 3, 2, 3, like that. So they are inflation breaths. Now they're given for 30 seconds. So for how long are they given, John? 30 seconds. Yes, very, very good. So now after that, we will see. Now we move on to the chest wall. With the chest wall, and also we will check the heart rate. The heart rate, if there is no increase in the heart rate, still it is less than 100 only, and see whether chest wall is rising or not. If the chest wall is not rising, if it is not rising, then we can consider giving second set of inflation breaths which increased in the inflation pressure. We can increase the inflation pressure and give a second set of inflation breaths. That is the 5 breaths. So that, and at the same time, we need to recheck, make sure that the baby's position is correct in the neutral position. The mask size is a correct size mask, and also sometimes we can consider suction also, and then we can give the consider putting the laryngeal mask for ventilation, and also tracheal tube. So this we can call, we already called for help. One of our colleagues will be doing. They will help you because alone we cannot manage this emergency. So you need to call for help. So our colleague will be doing one of this thing. Now, once here, one person will hold the mask in the CE grip, and another person gives the inflation breaths. So this way, we will give the inflation breaths. Then where we have to reassess again. So if the heart is not increased, so and then look for the chest movements. If the chest movements are present, if the chest is moving, you continue ventilation breaths. Now, let me tell you about the ventilation breath. What is ventilation breath? It is a short breath. They are the short breaths. So this is the short breath. So this way we do the resuscitation. So what are the ventilation breaths? John, yeah, they are short breaths, Manjula. Okay. This way, we do the resuscitation. So in the exam, sometimes this is for your information, not this is not exam. In the information, I mean, this is for your information. Sometimes the examiner will ask only this part. They will not ask the compression part. They will ask only this part. So then in that case, you have to stop here only and say then suppose he asks you to say compression part also, then we move on to the compression part. So now, suppose he asks a compression part, then we need to say. So now, then we are continuing the resuscitation. If heart rate, now we are assessing. So when we assess, if the heart rate is not detectable, or if it is less than 60, after 30 seconds of ventilation, then we need to go for the compression part. That is chest compression. So that is chest compression. It is synchronous with the 3 chest compressions to 1 ventilation. We need to give 3 chest compressions to 1 ventilation. And the oxygen is increased to 100%. And we need to consider intubation if not already done. By this time, if it's not done, we consider intubation or laryngeal mask. Then, so chest compression, we need one person who will do the chest compression. That is, we keep the 2 thumbs on the sternum, and all the other 4 fingers will be encircling the chest, and then give the compression. So, then we need to assess every 30 seconds. Heart rate and chest movements are assessed every 30 seconds. If the heart rate remains not detectable or less than 60. In spite of this compression, chest compression, we need to think about, if there is no adequate response, then we need to think about giving drugs. So, like we have to have the umbilical venous catheter where we can give some drugs like adrenaline, soda bicarbonate, and then dextrose 10%, 0.9% sodium chloride. So then these are the things which we need to give through the IV access. Sometimes the factors can be if there because there is there's no response to the resuscitation, we need to think about the few factors like pneumothorax, hypovolemia, so, and then need to direct treatment according to the towards the cause. So then we have to one of the team member will be updating the patients, the baby's parents. They will be debriefing about the what is going on. At the same time, we debrief the team also. Then once the registration is complete, we do the complete documentation. So this is what we do, John, about the baby. So now what about the after once the baby is resuscitated, then the post-resuscitation care. I would like to tell you a word about the post-resuscitation care. Baby will be in ICU. We need to document each and every step, debrief the mother, the parents, and also our staff, colleagues and staff. Then one thing is when to stop the resuscitation. It's an important decision to make when we need to stop the resuscitation. It depends upon the hospital protocol. If after 15 to 20 minutes of resuscitation, it's unsuccessful, then there is no breathing or there is no heartbeat, then we have to stop the resuscitation, that is discontinue the resuscitation. So and this way we will manage the newborn. This is about the newborn resuscitation. So am I clear? How did the session go, John? How did the session go? Could I convey, could I explain to you about the resuscitation clearly? And then, John, I found you to be very enthusiastic learner. I am going to give you few handouts and also some videos you can go through. And so then you can, whenever a baby is being flat or floppy, or then you can observe when your senior does the resuscitation, you can observe how it is being done and what are the precautions we need to take. So anytime you have any doubt, any issue is there, you can come back to me always. So this way we manage the resuscitation, newborn resuscitation. Thank you for your thank you for coming to me and asking me to explain to you, John. It's okay.